Hey folks, hope you're well. It has an odd feel at this point. We've been doing this for a month and a half or so. There are some signs that maybe some things are letting up. With caution, we'll see. Please sign up for summer and fall classes. I'm not teaching this summer, but everything this summer will be able to be signed up for, and fall even now. So do that if you would. All right. So we're going to talk about cognitive behavior therapy. And this is a kind of therapy or counseling that layers onto behavior therapy, which strictly deals with behavior, the aspects of thinking. In particular, the ways in which we distort the kinds of thoughts we have that make symptoms worse. And the emphasis, therefore, is on changing those thoughts that can make things not so good, the irrational thinking, the automatic negative thinking that we might have, can make the behaviors more intransigent, more difficult to change, yes? So the big names here are Albert Ellis. I think he's still alive. He's a irascible Brooklynite. And Aaron Beck, who started the cognitive therapy, focusing mostly on the thinking aspect. He originally worked with depression and discovered that this is a very useful kind of way to think about things. But cognitive behavior therapy has been around quite some time. In the 80s, early 80s in particular, most treatment people would have said they were an integrative type, an eclectic type, using different methods combined. And now the predominant grouping is cognitive behavior therapists and counseling. And that's because it is very, very amenable to the scientific process in evaluating treatment goals and evaluating the effectiveness of various kinds of treatment. And because it's been around a long time and it's able to be demonstrated as a wonderful combination of the thinking and the behaving, it's been extended to many different areas, and there are many subtypes of cognitive behavior therapy. There's one just for panic disorder called panic therapy, for example. So let's move forward a little bit. So basically, cognitive behavior therapists want to form a collaborative alliance with the client, much like the behaviorists do. And they believe that much of psychological distress really is not just or about learning in one way or another. It's about the distress that we cause ourselves in the disturbance of our cognitive processes. That's what it's about. So the focus is on changing the cognitions to produce desired changing in emotion and behavior. Okay. It's time limited, average number of sessions, dependent on a number of factors, but something around 15 or 20, something like that. And it is a really interesting way to look at where our distress comes from. We are born with the capacity for both rational and irrational thinking, say these folks, and that's true. Our experiences guide that to some degree. We are very self-evaluating entities, humans. We have a biological and a cultural tendency to think in both negative and irrational ways that vary to some degree from culture to culture. And we actually perpetuate our distress by repeating these kinds of unproductive thoughts that we have. And we're often unaware of these things. We say them so quickly and so often they become consciously unavailable to us until we pay close attention. Okay, so one of the most common subtypes of cognitive behavior therapy is the one developed by Ellis called rational emotive behavior therapy, originally called only rational emotive therapy. You are going to be trained in this kind of therapy because it is that common and really could be thought of as dominating treatment these days. If you go to UCO, which many of you may, you will perhaps be pulled into a room and do nothing but reflect. You may remember me talking about this in the listening skills section, and that's the foreground to eventually learning what kinds of irrational thoughts people are having. You'll get a sense of it when you add in some other skills like asking them some questions. Okay, insurance companies love this kind of therapy because it's easy for them to understand it. I think I just bashed insurance companies, but at any rate, I have a link to Albert Ellis doing a therapy session. I want you to watch that too. That'll give you a sense of it. Now, Albert Ellis was also someone who was sort of aggressive in his style. He developed it. It's not quite as assertive as it is now. But there are lots of techniques, and there's lots of homework that you will give a client as a therapist. So this is an interesting, very active therapy, much like Gestalt is. Okay, so we believe as cognitive behavior therapists, though I am not one, that we have the freedom to choose our emotions, our behaviors, and our lifestyle. Wow, we choose that? Yeah, we do. We choose our emotions. We choose our behaviors. We choose the way we want to live. Yeah. Now, there are always restraints to this and constraints to this, and we have to live within those, but we can do that. We are capable of having realistic thoughts, rational thoughts, and behaviors that are proportionate to provocation by the environment and the circumstances that we are in. And we can have lasting changes, and we can even apply if things need to be tweaked. We have to revisit the process that we learn in a therapy setting. We can reapply those techniques in our own life. So this kind of therapy, cognitive behavior therapy in general, stresses things like thinking and judging and deciding and evaluating and analyzing, but mostly it stresses doing as opposed to just thinking or just feeling. And so another key ingredient here is that thoughts and emotions have a reciprocal relationship. That is to say, they interact in both directions. So behaviors generate certain emotions, and emotions generate certain behaviors. And so they both have to be handled, and that's part of what cognitive behavior therapy does. So this kind of therapy is highly didactic. We're actually going to teach them some things and instruct them about how this works in terms of thinking and feeling. We're going to tell them about that. It's somewhat directive. We're going to suggest and ask them to do certain kinds of homework, for example. And it is really more concerned with thinking than feeling. Okay, and that's by doing. Okay, so by auto-suggestion, by repetition, by installing new beliefs that are rational, looking carefully at the irrational ones and supplanting the rational ones, the irrational ones with the rational ones, the irrational ones with the rational ones, we can make lasting changes. So, as I said, this kind of therapy has been used in so many different things, it would be easier to name the things it hasn't been used in. Yeah. So everything from anger management to addictions and depression and anxiety disorders and adjustment to chronic health problems. And I have used cognitive behavior therapy, though I would say I'm more existential than perhaps anything else. But I've used it for depression and anxiety problems and OCD in particular. There are conditions for which cognitive behavior therapy is clearly the superior choice. Okay. It can be used individually. It can be used with groups. It can be used with couples, with families. It can be used in any modality you can name. It cannot be used so effectively with clients who are very concrete and cannot think about their thinking. Okay, so people who are cognitively impaired, people who are exceptionally concrete, people who do not want to look at their thinking, it makes it more difficult for that group. Yeah, but generally people can use this who are only mildly impaired or only mildly unable to look at their thinking. So I want you to think about things we do, just examples. So you've already heard me say that we help clients identify their irrational thinking and to dispute them. So if someone says, I always say I'm stupid, it's always under my breath, and I probably say it more than I do, and they do homework to find out how often they say that. Let's say that's the dominant automatic thought they have. Okay? And we would say, well, what's the evidence that you're stupid? Well, I made a mistake. Well, but everybody makes mistakes. What's the evidence that you are stupid? Is there any? No. And they'll go through, they might fight you on that a bit. And that's really what you might see. You'd have to really stick a crowbar into the irrational thoughts because they've been with that person for so long, they actually have learned to believe it. So irrational self-beliefs get in there and actually do affect the way you think about yourself. We want to replace that ineffective or irrational thinking with effective and rational thoughts and called cognitions. We want to stop thinking absolutely about things, absolutistically about things. We want to stop blaming and we want to stop repeating the false beliefs. That's what we're after in the thinking part. Okay? Now in the behavior part, we want to have what's called exposure. We want to have some approachment of the things that are causing them trouble. Okay? So if someone has, for example, obsessive compulsive disorder, and they fear contamination, so they have developed a checking compulsion, and they wipe everything down all the time, and now they're cleaning everything. They can't get out of the house without using sterile wipes, although that sounds like what I'm doing at the moment. Wiping everything down, then under non-pandemic circumstances, that would not be rational behavior. Okay, it stems from an irrational belief, doesn't it, about the way in which things might be contaminated. So you would address that, but then you'd also have to address the behavior. So you'd have to have some approachment in a stepwise fashion, wherein they actually may, for example, leave something uncleaned. Okay? All the way up to touching something they know is dirty. And what happens is, in this kind of case, is they'll have a big spike of anxiety and then discover that the anxiety goes away very quickly. So one of the things you're going to be doing before you do the exposure is you're going to teach them how to use thought stopping and deep breathing and progressive relaxation. You're going to give them opportunities in the session and then at home with homework to learn how to very quickly and effectively and efficiently relax themselves mentally and physically. Okay? Those are just examples of some techniques you can use. So this kind of therapy works really, really well. Works really, really well. After this, look for one additional video that I'm going to post, and I think you might enjoy that one. It doesn't have a discussion question associated with it, however, but I hope you look at it. And do like and well, you can like or unlike, it's up to you. But subscribe to it if you would, and then you'll know when the new ones come up. Okay, thank you. Bye.